Monadeepa, why does the West Bengal government term COVID-19 as an incidental cause of death in a number of cases in the state?
Vishnu, that's a question that many have been asking of the government. On the 3rd of April, the government set up this committee, an expert committee, which is called an audit committee, to decide on which is a COVID-related death and which is not. Till yesterday, the figure was 15, and many people, the governor, opposition parties, as well as a section of doctors had raised this question of why this differentiation. Now, in the letter that Mr. Apurva Chandra of the central team has written to the Chief Secretary, he makes a very interesting point. He says that the Principal Secretary of Health explained to him that if you are a COVID-19 patient and you are going to a hospital in an ambulance and you have an accident, then what will be the cause of death? That is why you have a comorbidity coming into consideration, because you will then have died in the road accident, but you remain COVID-19 positive. Anyway, the long and short of it, this is a question many had raised. Today, the Central Committee raised it. They raised the point that is the ICMR regulation, is there ICMR regulation on the audit committee? Is the audit committee set up according to ICMR guidelines? Does the state government have other audit committees into other health situations? These questions were raised this afternoon in a letter by the central panel to the Chief Secretary, and in the press conference at 5 o'clock, the Chief Secretary for the first time gave us a complete picture that 57 people have died, 57 who were COVID positive. And of those 57, the audit committee had decided that 18, as of today, 18 people have died directly because of COVID-19, and the rest 39 have died because of comorbidities with incidental COVID-19 complications. This is going to create a bit of embarrassment for the government, because there have been so many questions on this. The governor raised it even in his letter to Mamata Banerjee today. Meanwhile, of course, this is a question many of us had asked as well, but we had not got an answer. Today was the first time that this clear picture has been put out. Officially then, today, COVID-19 deaths number 18, but including comorbidities, it is a total of 57.